Hi, Sophie. Amira here from Juno. Just wanted to check in, see how you're doing.
Hi. I'm just trying to steer the speakers to the Juno platform right now.
Okay,
So,
great. Let me know if you have any difficulties. I'm here to help.
of course, thank you. I just wanted to check in real quick.
Mhm.
I can share the audio, right? If we
Um,
want to share videos.
yeah, and I can show you how to do that. It needs to be if you're using Google Chrome, it needs to be in another Google Chrome tab in order to share the audio.
Yes, I think. Let's see. Yeah, I have the link. Yeah, I have to tick the box.
Great.
Perfect.
We can walk through that whenever you'd like.
Let's see. For example, this one, share audio.
Yep, you gotta click that. All right, you can expand your screen too, if you'd like.
Um, can you see this?
I can see it just fine. Let's try to play it and see if it plays properly. Okay, I'm not hearing it. And you clicked share audio?
Yes, I did.
Okay, and let's see. Why don't you go in, exit out, close out your screen share.
Mm-hmm.
Go to the share desktop button again.
Mm-hmm.
And rather than sharing an entire screen or a window, go over to that third option. It should say Chrome tab. Do you see that there?
Yeah.
Try to share the tab there and then click share audio at
Mm-hmm.
the bottom.
Reproductive health, including that of
There
adults.
it is.
Is it working now?
Yes, I can hear it just fine. So that's how you're going to share. When you go to that share desktop, instead of choosing entire screen or window, you'll go over to Chrome tab. Make sure that
Mm-hmm.
share audio button in the bottom left is checked. And then you will click on the tab you want to share and you will be able to play with audio.
Fantastic. Thank you so much.
Of course, of course. That's what I'm here for. I'm going to hop into another room, but I will be in the background and in the moderator chat for you if you have any questions, and I'll check back in a few minutes.
Okay, so if I ask you something through the moderator chat, it will be only you receiving that, right?
It will be, yes, myself, any of the other speakers, and any moderators from the group that are going to be in the room, but the actual participants of the session or attendees will not see that.
Okay, thank you so much.
Of course, I'll be back in just a few minutes.
Perfect. Hi, everyone. I think we have 22 minutes left. We have Martin and we should have Dr. Chandra. Anyone else that we have in the room right now? I don't think so. Fortunately, I cannot hear you, Dr. Chandra. Have you tried unmuting yourself? It's the left-hand corner, second button, next to the camera. And likewise for Martin, can we check if you guys can speak?
Hey there.
Hi. Perfect.
Hi, can you hear me now?
Hello, this is perfect. Yes, we can hear you and we can see you as well.
I'm in my attic office.
I'm with my plants.
For some reason, Sophie, I'm only able to see the bottom part of your face.
Oh.
I don't know if that's only me. Do you see my face? And do you see
Yes,
the
I
bookshelf
do.
behind me?
Yes.
But I now see only from your nose and below.
I don't know why that is.
I don't know if that is for the others as well. So just check. Maybe it's
Martin, how can you
yeah,
see
now I
the
can
screen
see you.
or?
Now I can see you.
Okay, maybe it was a glitch.
No,
I think
I just moved the cursor up, so I'm one half of the screen. I see you, the other half. There's Martin, but it's black on my screen. I don't see Martin.
yeah. I'm trying to turn on my camera, but it seems that
There's something that you have to click, and it asks you whether audio and video, and you have to accept.
Yeah, I think because I have. Oh, I found it. I have few cameras, so I think it's doing the wrong camera. Let me try this one.
So
Oh,
Martin,
whoa, that was really close. I can see myself really close. Yes. Okay. It is quite
hi
of a
Martin.
cut. Nice to see you again.
Nice to see you. So Sophie, after you finish, Maureen will go first, and then Martin will go, and then you'll have a few minutes of discussion, and then I'll take a minute to introduce the video.
Just a moment, Dr. Chandra. I have Danielle on the other line.
Okay.
And I will steer her towards us, and I'll be right with you.
Where are you, Martin?
I'm currently in London. I'm based in London. I live here. Yeah. What about yourself?
I'm based in Geneva.
Geneva. Yes, that's where ILGA World's office as well is. This. It's in
Pardon?
Geneva.
What office?
ILGA World, the organization I'm a board member of.
Okay.
That's where they're just based, just across the High Commissioner's office.
Okay. Okay.
They're quite close by.
That's a
Yes.
beautiful spot on the lakefront.
Yeah, he's quite nice. They were quite lucky. Another charity gave them a opportunity to access the space as well. Yeah, it's really strange. Today there was a protest in London of anti-COVID, anti-vaxxers, and I was just walking I was just walking down the street and I saw them and they start shouting at me, take off your mask. They were saying, man up, take off your mask. And it was just, but it was hundreds, it was thousands and thousands of people. It was just really
It's
so
difficult to
strange.
understand. Huh? It's
Yeah.
difficult to understand when, particularly when you've had so many deaths. It's so hard to understand this.
It's really, I think, and I find it really frustrating as, like, as a person who's, lost people close, and it's just really irritating, the ignorance, not only the ignorance, but also like people like how aggressive they are towards others about it. I think that's the
Yes. And aggressive, because it's about imposing your views then on other people. Yeah.
Yes. Yeah.
Hi, Daniel.
Hi.
Can you guys hear me? Good. Okay.
Yes. Can see you well. So, Sophie, what I was saying to you was, after Maureen and Martin speak, then you'll have a few minutes of discussion.
Yes.
And then I'll take a minute or even less to introduce the video.
Of course.
Yeah?
Yes.
And then after the video, Daniel can come in immediately, and then we'll be on standby for any comments and questions.
Precisely. Yes. Hi, Maureen. Welcome.
Chandra, will you talk about COVID as well?
Yes.
Yeah.
Okay. I will mention that, essentially saying the COVID threatens to push back the progress made.
While also recognizing, I can say that we don't have data yet. I mean, we only have anecdotal evidence of that and need to look into what's actually happening. Okay, I'll be back. Just give me 1 sec.
Of course.
Hello, Maureen.
Hello, Dr. Chandra. Great to see you all.
Glad to see you, and I hope you found a place where you have good internet access.
Yeah, I'm basically using my data. So I found a place where the network is a bit stable. And I'm just realizing that the platform is kind of like locking my video. Is it okay? Because I did not switch off the video. It switched off itself.
We can see you, but we don't see you moving.
We
see a bright smile on your face.
Oh, so I kind of like put a picture of that. So that is my picture. So it's not my video.
That's right. And maybe that's okay. It's better to just have the video rather than have the image rather than have the video and you freeze when you're speaking. So the photo is enough.
It's okay. It's okay. Thank you. So for my sake, if you can go through the floor once again.
Hi team, this is Joseph from Juno. I am just dropping in to make sure that all is well. Are we experiencing any issues or questions that we have?
So far, everything is good. Thank you.
Yeah, everything is good. Awesome. That's good to hear. And all of the speakers are here?
Yes.
That's good to hear. It looks like you guys are set and ready to go with about 13 minutes left. So you've got time to go through some things, go to the bathroom, get some drink. And best of luck, y'all.
Thanks.
Thank you, my friend. All the best.
Thank you as well. Have fun. Bye-bye.
So Sophie, if I want to put my video on sometime, I think you should have answered it how to put it on, because then it looks weird. I'm the only one off.
It's okay. But if you decide to turn on your video, perhaps during your presentation, you can go to the bottom left-hand side and you will see a little camera icon and a mic. If you press the camera icon, it should turn itself on. Can we try it?
It is on, and it is not displaying anything.
No, it's not.
It's red, Maureen, because I had the same problem. I thought red is off, but is the camera turned? Is the camera symbol red on your screen?
Yes.
I think Joseph is with us in the room again. Maybe you could ask him, Maureen, just to make sure.
I can see him. Hi, Joseph.
Hello, I'm Sophie. I will be moderating with you the questions, the chat, the YouTube channel, vice versa. So if you have anything to share, like a link or whatever, I will be passing it to the YouTube attendees. Yes, and I would like to remind you to read the code of conduct before we start. Please use the mod channel you see on the right top. This is our private communication. If there is something urgent, we can share it there. Okay? So sometimes it depends on the speed of your internet for the camera to turn on or the voice. If you hear some echoes, maybe you need to turn off the camera to make it lighter. What else? Any other questions before I disappear?
I think, Maureen, you could ask the question about your video.
Yes, Maureen?
And Dr. Chandra, can I share the link to the video here so that it is also shared on the YouTube live stream? The one that we are supposed to broadcast as well.
It's openly accessible to everyone. So you can share it with anyone, and the more people who have access to it, better. So there's no reason to not share it. Hi, Rebecca.
Thank you, Doctor. Yes, please, Sophie. Sophie and Sophie. Share it with me and I will pass it to the YouTube attendees. So
I just shared it through the mod chat, and I will also share the link for the Slido.
Okay, I will do so in the flow of the session. I won't do it right away, okay?
Yes.
So good luck. I'll be around.
Please don't go away. Don't go away, please. Maureen,
no, I'm behind
Maureen had a question for you.
Yes, Doctor.
Maureen had a question for you. Maureen was unable to switch on her video. Could you please help her?
Yes, Sophie, my camera is on right now, but then I am not displaying. So I would like assistance because I'd like to be in the video, like the fellow speakers.
You see now, yeah, Maureen, you see now mine worked. So maybe it is, you click on the box that says off and on. It's the sign of the camera, right?
Yeah.
We have 8 minutes. We have the time. Maureen, please log off and log in again. Maybe that will better your connection. Okay.
It's all right. It's all right. And also the website for YWCA Kenya, it is on the chat box for someone who wants to know more about YWCA. So kindly help me share it, probably.
Of course.
Send it to the mod chat.
Yeah. Sophie, you have Sophie with you and Sophie behind the scenes, okay? So good luck. So Maureen, give it a try.
Thank you so much. So Sophie, can I get like the flow of the session once more, because I joined in?
What do you mean?
I mean,
The session hasn't started yet, Maureen.
The session hasn't started, but then when we start, I'm the first person to speak. So speaking for 5 minutes, and then you show the photos, or how is it gonna go? Because
no, please go on.
Can I see the? Is it possible to share maybe the order of the photos as you put them?
Yes. Let's see.
I'm just going to go get something to drink. See you all in a few minutes.
Yes, of course. Let's see. So, Maureen, I will share the link in the mod chat. And you should have access to it.
So you will be sharing the photos in terms of a link, but not like on a screen?
I will be sharing it on the screen, yes. I'm just sharing this for your reference. I will, so first we will have the introductions. We will share the housekeeping rules, the aim, the agenda. We will ask the participants to introduce themselves, and then we will have 2 slides on Slido. We will go to the presentations. I will introduce the speakers. Afterwards, we will go to your presentation, Maureen. I will share the screen and you will present. Then we will have Martin's presentation. Likewise, I will share the screen for Martin. Then we will have the first Q&A session.
You mentioned that I will share my screen. That was our first discussion that before we talked about.
Yes, we changed it up a bit. I mean, I think it would be easier if I did it, but if you prefer, you can also share it. It's I think it'll be fine.
Yeah, I mean, I can be quite quick. I have the access. Sorry,
okay.
because that's how I've prepared in my head. So
okay, yeah, no worries. So Maureen, then Martin, then a Q&A session. Then we will have Dr. Chandra presenting the video. We will have the video. Then I will share the screen for Danielle's presentation. Is that okay with you, Danielle? And we will have a Q&A session again and a 5-minute health break. And then we will invite the participants for a conversation to share their case studies, solutions, focus areas, all of that. Danielle, could I ask you, is it still okay if I share your slides, or would you like to share them?
Yes. Yeah.
Okay. Perfect. And
also all the background documents which I shared with you, and the links, you can share them with the YouTube audience as well if you want.
So all the resources 2 resources I've uploaded below the session, so everyone can access and download them, and the rest we will also share after the session.
Okay.
Hi, Rebecca. Nice to see you here.
Is there anything you would like me to support you with, Sophie?
Perhaps
I'll take notes.
Yes, perhaps that.
And this outcomes document, so the session that I facilitated earlier, we never got to the tips. So I'm pretty keen. It was a very short session though. So I'm just hoping again that we can get to the actions by the participants and the tips. I'm sure you will do a great job, Sophie. Yeah, so we kind of missed that and now we have to work on it and send it out separately. Yeah.
That's a good thing to keep in mind. Thank you.
So yeah, have a great session.
So we still have 2 more minutes. Thank you for sharing the link, Martin. I will direct this to the mod chat. So I see people are joining our room, and we will go live in 2 minutes.
How
So
many do we have finally, Sophie?
I don't know. I think we just have to wait and see. Rebecca, do you have the information? How many registered and how many will be joining us today?
Well, it was over, I think it was nearly 60. And so if they can join you, they will join you. I will actually remove myself from the screen now and just watch from I can post in the chat, just so my face is not on the screen. Yeah.
What did we say? The chat is for us? Or the mod is for us?
The mod is for, private, like moderator links and stuff.
Okay. And my other question is, should we turn off our mic when we're not speaking?
Yes, please. And I see people are joining us. And this is exciting. We will be live in less than a minute now. So I hope everyone is prepared and energized.
Good luck all.
Good luck. I'm sure this will go very well. So
Sandra, you have your red wine glass ready? Maureen?
She's not on the screen. We have, okay. We have a lot of people joining, and 3, 2, 1. And I think we are live now. Hello, everyone. Welcome. This is very exciting. So welcome to the session. What does a pandemic have to do with it? Finding practical solutions to sexual and reproductive health challenges together, and the Global Youth Summit at large. Some of you are joining us through the Juno platform, and many more are joining through the live broadcast and multiple social media channels. So I would like to welcome you, all of you, today. And this session will be rooted in shared values of collective care and mutual respect. So before we kick off, we suggest the following housekeeping rules. Please note that this session is part of the Global Youth Summit, and we strongly encourage you to explore other sessions in any of the other 3 tracks each day of the summit. By joining the session, everyone who will have the opportunity to speak consents to their image and audio being broadcast. By participating in the Global Youth Summit, you have agreed to behave professionally, respectfully, and be culturally sensitive towards other people to promote the principles of respect, diversity, and inclusion, as well as to actively prevent and not engage in abusive behavior of any kind that leads to any harm, prejudice, discrimination, harassment against any person. If you do not adhere to these principles or Summit's code of conduct, you will be removed from the session and potentially banned from the entire event, and the organization that nominated you will be notified of your actions. We have a safeguarding team moderating our interaction on the Juno platform, the live broadcast chat function, and all social media channels. So should you at any point feel unsafe or witness concerning behavior, please reach out by sending an email to safe@globalyouthmobilization.org. Again, that is safe, S-A-F-E, @globalyouthmobilization.org. And you may also get in touch with our support team at the virtual help desk. All information emailed to the email address will be kept private and confidential. And this information, including the email, will be shared in the chat as well. So please turn on your camera if you want to, but it is definitely not mandatory. Sometimes if you keep it turned off, you will actually get a better internet connection. Don't forget to mute yourselves when not speaking, and likewise, don't forget to unmute yourself when you would like to share something with us. Please raise your hand when you want to share something, and the facilitator, myself, will give you the floor to speak. As always, be open to hear and learn from each other. Be aware of the power structures in the world as well as in this session, and be ready to challenge your own assumptions. If you have any questions at all, please feel free to ask them in the chat. So my name is Sophie. I will be your facilitator today. I am a sexual and reproductive health and rights activist and advocate, and I'm the chairperson of UACT, which is the European Youth Network on Sexual and Reproductive Health and Rights. With us, we will be having a lot of very interesting, amazing, inspiring speakers. We have Martin from ILGA World. We have Danielle representing UNFPA. We have Dr. Chandra from WHO, and we have Maureen from YWCA Kenya. So welcome. We are very excited to have you all. I see people joining. Hello, it's Josephine from Bangladesh. YWCA, hello from the US, Romania, Kenya. So a diverse group of people joining us. And I would like to ask everyone if you could just briefly introduce yourselves, maybe write your name, your country if you feel comfortable, perhaps preferred gender pronouns as well, and your organization or anything else you would like to promote, like, for example, your organizational link. If you recently wrote an article that you're particularly proud of, you can always share it here. And we have people from, Casey from Switzerland, she, her, World WCA, Netherlands, hello, Benjamin, Scouting, Finland, wow, Canada. We have a lot of people joining us today. So let's give 2-3 minutes so that people introduce themselves. Milena from Costa Rica, hi. We have a very active chat, very exciting. And we would like to ask you to get ready for a bit of interactive session. We have 2 questions for everyone who is attending through the Juno platform, but also through other social media channels. And let's go. We have these questions for you. Please go to slido.com and type the code 999571, and you will be directed to the poll that we created just to see your expectations. So the first question is, why did you decide to join this session? And as a sample, we already have an answer to find out how I can implement solutions on SRHR in my community. So feel free to join in and send us your replies to slido.com. And again, the code is 999571. So send us your motivations, basically. Why did you decide to join the session? Tell us. We are curious to hear, to find out how I can implement solutions on SRHR in my community, to learn from experts in different fields on a topic that is important to me. Fantastic. Okay. Feel free to send them. You can also actually scan the barcode on the left-hand side, or you can go to slido.com and type 999571, and you will access our active poll. Introduction to the subject. Okay, good. To see how sexual and reproductive health are affected throughout the world, to hear diverse opinions about SRHR. I'm really curious what I can do to be more socially active when it comes to this particular topic. I feel like I should be brought up more, of course, to broaden my knowledge about topics like these. I'm passionate about SRHR, specifically using social and behavioral change communication to address issues, gain a global perspective. Wow, intent is to listen and support. Fantastic. So we also have a second question, which is, what would you like to get out of this session? So we want to hear your motivations. What would you like to get out of this session? How would you like to use it? Would you perhaps want to embrace activism work? Would you like to learn more about global state of these issues? Yes, more info and more knowledge. Would you like to write something about it? Would you like to become a professional in the field of SRHR, perhaps work with WHO or UNFPA in the future? New ideas and info, useful opinions from people who are considered professionals in this field? Yes. Gain more knowledge, new ideas. Wow. I'm really impressed by how many active participants we have. I'm really happy. More informed on the topic in order to communicate. Awesome. Awareness. Yes. New ideas and new information. Oh, and important information also for people joining us through YouTube or other social media channels. You can actually also see subtitles, translations in Russian, French, Spanish, and Arabic. So we can have more people attending and participating. Advocacy, awareness, new ideas. Wonderful. So I think I will stop sharing my screen now, and we can already go to our presentations and to our wonderful speakers. Thank you all for participating in the poll again. And I would like to invite Maureen for our first presentation today. Maureen, are you here with us? Maureen, are you here with us? Perhaps some of you are also experiencing some technical difficulties, which is okay, and don't worry about it. We will figure it out. Make sure to contact the IT at the support desk. And while we are waiting for Maureen, perhaps Martin, you would like to start the presentation.
Hi, everyone. Great to be here today. I hope you can see my screen. Yep, you can see my... Is that it? Yeah, okay, great. I can't do both for some reason, so I can't see you. But I'm glad to be here today. So thank everyone for joining today. I will be speaking today particularly about the impact of COVID on LGBTIQ young people and their rights, particularly around SRHR, but also in general as well, to their access to healthcare. For those that you already probably know, but LGBTIQ young people face discrimination across the world in each country, in every country across the globe. LGBTIQ young people face criminalization in several, often death penalties, and some of them as well, as you can see on the map here, which I can see, but I can't see your faces, unfortunately. And during the pandemic, young people still face, apart from those criminalizations around their rights and who they are or who they love, they also face a wide range of harmful practices, which are often performed by SRHR services and also medical professionals as well. These harmful practices include sterilization requirements, which often target trans and gender diverse young people in particular, but also the unethical, medically unnecessary surgeries on intersex young people and children who despite being allowed across the world, are still disregarded. Also, the so-called conversion therapies, who are torturous practice across the world and still legal in 180 countries across the globe. And despite that, they're still lacking on the conversational global level in harmful practices. And lastly is the higher level of violence LGBTI women and girls face, particularly trans women of color, and discrimination. LGBTIQ young people face a lot of socioeconomic challenges as well, and social isolation for us is not something new. We faced it while growing up, but COVID has really presented unprecedented challenges and further marginalization for our communities. During the pandemic, young LGBTIQ young people have been further facing violence and discrimination from their communities. They have also really experienced their mental health at higher levels, and whilst having need to access mental health services, these services didn't exist in their areas. We also know that during the pandemic, young people wanted to access a lot of LGBTIQ specific services, but due to restrictive legislations, which often leave them out, which are quite a lot age restrictive, often young people are left with completely no access to services and left in the gap and left trapped in toxic home environments, which leaves them to leave their houses and becoming homeless. Homelessness around LGBTIQ young people is nothing new and has always disproportionately impacted our communities, but during the pandemic has really increased and put a lot of young people at risk with no access to shelters or any of the mainstream service provision as well. We also know that during the pandemic, many stakeholders and states have used this pandemic to target particularly LGBTIQ rights, and in particular, trans youth access to healthcare, as we've seen in Hungary with legislation that was passed last year, and also most recently in Arkansas, one of the states in the United States, that passed a legislation limits access for trans young people, vital access to healthcare. Many more states are considering similar legislations, and other countries which want to deny the access to reproductive and vital healthcare of trans people across the world. We know that this pandemic has really not put LGBTIQ voices in general at the forefront. And what we are risking is that by excluding LGBTIQ youth in particular, meaningfully involving them in the design implementation of COVID, that we leave another generation of young queer people further marginalized with no voice about their future. Today, I would like to bring to you this perspective, is that often what we've seen that COVID has presented is the attacks on reproductive rights, attacks on women's rights, attacks on trans rights often go hand in hand or one after another. And by us being silent on one, we are often enabling the other. Silos are enablers. And that's why my call for everyone today, and hopefully in our discussion we can bring this, is how us as communities across the different fields and sectors and intersections as well can address these inequalities and fight together, so every young person, regardless of their identity, we can protect their bodies, rights, and lives for everybody. Thank you.
So much, Martin.
I can see you now. I couldn't see you the whole presentation, but I can see you now as well. It was a bit strange because I was talking through my slideshow.
It was a really interesting presentation. I see Suchi writing, thanks Martin for the great insights and stories, such valuable lessons indeed. Guys, if you have any questions for Martin, if you want to ask him something, if you want to share your experiences, please feel free to write them in the chat and we will address them in a bit. But before that, I see that Maureen has rejoined us. Maureen, can you confirm?
Confirmed.
Perfect. So I will share the screen now with your presentation. Can you see the screen? I hope.
Yes, I can see the screen.
And we can start.
Okay, everybody, how are you? Hello, everywhere, where you are tuning
for being here. My name is Maureen Magak. I come from Kenya. I am a young woman mentored and brought up literally by YWCA. I'm so glad to be here before all of you and with the previous speakers. And I bring you work that we've been doing at YWCA during the COVID-19 pandemic. And for sure, we can all tell that the has shaken us, has shaped how we are living, and it has transformed how we think. So I'm basically going to talk about the access of SRH services among young women, how it was. And we did not plan for anything, and now we can say that we are adjusting. So it was very to access these services. For one, we are living where, you know, the implementation of the SRH policies that we have is very low. Therefore, we are kind of like zero trophies. Now, we found ourselves in a situation where young women now became vulnerable by the onset of the pandemic, and it was not normal at all. So, yes, before the pandemic, it was bad, but then when the pandemic came, it was even worse. So, access to like menstrual products deepened and worsened. So, could sell themselves in terms of products by, you know, the popular people, young men called the border riders. You might have had them somewhere, but what we're saying is it became worse, and because of that, we had a lot of heightened teenage pregnancies that arose because of the pandemic. And if in Kenya, we had a lot of like 20,000 young women from the age of 14 years becoming pregnant only in one city called Nairobi, and over 100,000 girls and young women becoming pregnant the whole year. That is it was attributed to COVID-19. Many girls were out of school, many boys were out of school, and the government was not prepared at all with, you know, interventions of what to do with these children and young people when they are out of school. So what we did as YWCA, we had to, you know, shift and work with these young people. So some of the interventions we did was delved in advocacy by these young people and for themselves in the grassroots, and to just share with them and make sure we are together. So we talked about empowerment, where we had economic gap to make sure that they had some, you know, financial power to reduce the vulnerabilities of you know, that were brought by pandemic. And also we did a lot of that was soap making to just give them power to get an income. We also did a lot of mental health advocacy as a way to just bring, you know, the accessibility of services, because many men then, the reality is our young women are also home, therefore the GBV cases heightened, and therefore you find that in this situation where they have nowhere to go to, YWCA has to have interventions of just creating spaces that is safe for them to come and express themselves, and they can come and access the mental health services. So we also had a lot of a campaign in terms of FGM. Yeah, FGM cases increased a lot because the perpetrators took advantage that the access of services were limited. So we had a lot of campaign in places called Kisii and Meru, and also just to make sure that the people were protected even with the pandemic. Yeah, so maybe I can add that we opened up mental health spaces that are safe, and through use of art, We ensure that young people are able to express themselves. And again, one thing that is unique about this art space is that we brought men and women together to include them and share and make sure that we understand that the pandemic did not only come for women, it came for men, and nothing stops for pandemic. Access of services doesn't stop for pandemic. And as you can see that our young women have a right to enjoy their maternal health, they have a right to enjoy their lives, but it was not the same because there was a lot of queue when we went to health services. We are living in a community where a bigger number live below, and therefore they cannot afford to go to the public hospitals. But you find that the young women going to the hospitals could easily be turned away. One, there was a long queue, and two, there was focus on COVID-19 much more than their access to health. So we had a huge number of young women suffering from, when they are pregnant, they're suffering from loss of pregnancy, and those who did not lose their pregnancy suffered a lot of waiting, a lot of labor. And these are some of the cases that I dealt with personally when I got called to go and assist a situation, either in talking to the doctors to speed up the process, but it was not happening because, believe you me, they would even be asked to buy things like syringe. It's either you bought it to get the service, and if you didn't buy it in time, you still waited in line. So that was a lot for young people to take, and it was limited, and really still working to make sure it happens. Thank you.
Thank you so much, Maureen. I think this was a very eye-opening presentation for a lot of us. And thank you for sharing. And I see comments. Go, Maureen. Yes, a lot of links. Yes, actually, Maureen also wanted to share her organization's link with us in case you're interested in YWCA Kenya. Maureen, please feel free to share the link, and I can also paste it in the chat for everyone's reference. And guys, again, if you would like to, great presentation, Maureen. Yes, if you would like to ask Maureen and Martin questions, please feel free to write so in the chat, and we will open a Q&A discussion now. So I see from YouTube, Martin, what would be your recommendation for young people who are developing initiatives for gender equality and sexual reproductive rights in the midst of COVID-19?
Yeah, I think first thing, it's a good question because we all young people, I think, need to consider first their own mental health first, and I think is a lot of currently the pressure for particularly activists or young people who are involved in advocacy to deliver on services is quite big. I think is first checking with yourself how you are and how are you doing, and then look for partners, in your area where there is already service providers that deliver those services, or the unusual organization that you haven't worked before. There might be the right partners on this, whether it's faith leaders in your community that can support you, whether it is in older people within the organizations or adults within that. And also, I think one final thought on that is what I mentioned in my presentation is always ensure is that as much as you can, obviously with limitation, is that you have enough of representation of different people's perspectives and identities in that, because what works for one person doesn't necessarily work for the other.
Thank you, Martin. I think that's a really good good knowledge to take from this. Intersectional approaches, diversity, variety. I see some comments. So Rebecca says, Boda Boda riders are motorbike riders who deliver products and take people to doctors and hospitals. That is really amazing. Then we have, we have a link. Please consider signing the LGBTQI+ pledge. If you scroll a bit up, you will see the pledge, My Body, My Mind, and please consider signing that. We have a lot of praise for Maureen, well-deserved, important insights and good representation, of course. Powerful messages from both of our speakers. Please feel free to write questions if you have, and we will be addressing them. Pandemic was so bad that we had young women cooking stones to feed their children that food was cooking. Wow. Sensitive subjects, indeed. Intersectional. Question for Maureen. Did you face any challenges mobilizing the community when campaigning or creating awareness, including funding and people's motivation to participate?
Yes, we had a lot of challenges, a lot of it, because here's the pandemic. People are locked down in their houses, and the access to services does not stop for lockdown. And here are people that you want to work together. One, you have a lockdown. People are afraid to go out, but people are hungry. There is to be done. So what it was difficult to mobilize them because again they'll ask the one major question: get out of it, because it is a challenging time. Their money, am I gonna get food? And those are valid questions to ask because they're not working, they're indoors. And again, some challenges are that this is a pandemic, is a COVID-19, and the government people for some sort of activity. And do they have masks? And in a community where people the COVID-19 is opening some parts, so it was difficult to make, guys wear masks, and it was also difficult to get the masks. What happened was that it was difficult for getting the funding. At a point, we had to share with the YWCA members that the personal savings for the activities we had monthly, like the sanitary towels donations to the young mothers. So a big up for them. We the process to just to make sure that we reach there. So with the campaigning, it worked a lot because I can say that this is the time that YWCA has made because of digital space. Even beyond, I can say that campaigns, and that was. So yes, we had challenges with the community, but yes, we had partners who really came through, and we thank you so much.
Maureen, we actually have a couple more questions. So was there any progress with formal leaders and community that will be lasting? If you would like to comment on that.
Okay, thank you so much, Casey. Yes, I can say that during this pandemic, as I said, we've had a lot of interactions with the formal leaders because, again, they are the gatekeepers, and it is very sensitive if you have to do any community interaction. So we had to go through them like we've never done before. So you find that anything we did, we approached them, and when they just saw this is coming from YWCA and this is coming for the benefit of the people, they would give us a go-ahead, but not all of them. Sometimes someone would be like, asking you to go through a lot of bureaucratic processes, and if it was not possible, you'll be like, oh, maybe we can call them some other time to in a way that it's not a longer channel. But many of them are responsive, and we reached people that we normally wouldn't reach Yeah, and we also have engaged a lot of policy making platforms, and we are so grateful that that led to us being in a very important SRHR working groups that are working to reform policies on adolescent and girls in Kenya and also in our county in Mombasa. So yes, we had good interactions with the leaders. Thank you.
I'm very conscious of the time as well, but we have a lot more questions coming that we will address right after our two other presentations. So I would like to introduce Dr. Chandra from WHO. Dr. Chandra, would you like to say a few words before we show the video?
Thank you, Sophie, and greetings to you all. We've heard powerful messages from Martin and from Maureen, and they point to the desperate need of young people, and they also point to marginalization of young people. But I'd like to say something positive now. In December 2019, WHO worked with UNFPA to publish a review of progress in adolescent sexual and reproductive health over the last 25 years. We published a set of 4 articles, and we brought together a big group to do this, including young people. There were 7 young people from around the world who were co-authors. We identified them, supported them, paid them, and acknowledged their contributions. And you're going to listen to their voices and their messages over the next few minutes. But I just want to say 2 points from that, 2 messages for you as you listen to it. One, there was enormous progress over 25 years on many aspects of adolescent sexual and reproductive health. We often talk about problems, and yes, we must. But if we only talk about problems, it communicates the message that nothing is possible, nothing can be achieved. You will hear from the voices of the young people that enormous progress has been made. At the same time, you will also hear that much more needs to be done, and there are both barriers as well as opportunities. So that's my message to you all. Let's talk about the glass half full, and the glass needs to be filled wherever we can, so that we can point to progress and encourage progress. Over to you, Sophie.
In 1994, at the International Conference on Population and Development, 179 governments set out a groundbreaking call to action for sexual and reproductive health, including that of adolescents, to be placed on the global agenda. 25 years have passed since then. For us, Aditi,
Ali,
Ruben, Scheherazade, and Agle.
This anniversary is personal. We were all born in these years. We partnered up with international organizations, governments, academia, civil society, and funding organizations to publish a new journal of adolescent health supplement on the progress made on SRHR since the ICPD and the prospects for the next 25 years. Here are our key messages.
How has the world changed since we were born? There are more adolescents alive today than ever before. We are growing up in a different context than the generations before us. We live in smaller families, and we are more likely to be in school, and we are more digitally connected. In most of our communities, poverty has decreased, although rates of youth unemployment and working poverty have not. Sadly, we are disproportionately affected by humanitarian crises and emergencies, and we are already facing the dramatic consequences of climate crisis.
How has our SRHR changed in the last 25 years? Encouragingly, there have been concrete improvements in some aspects. Many of us initiate sexual activity later than adolescents in the past. Girls are less likely to be married and to have children before age 18 and are more likely to use contraception and have access to maternal health care. We are less likely to have sex with a partner whom we're not married to or living with, and we are more likely to use condoms correctly and consistently. Girls are less likely to support and experience female genital mutilation. On the other hand, though, some aspects of our SRH remain major issues. In many contexts, menstruation is still seen as a taboo topic. Although HIV incidence has slowly declined, deaths due to HIV have not. Levels of STIs and intimate partner violence are high and growing. For example, 120 million girls under age 20 have experienced sexual violence. Finally, we still lack good data on unsafe abortion and the morbidity and mortality resulting from it.
How have the political, research, programmatic, and social responses to adolescent sexual and reproductive health and rights evolved over the last 25 years? Some aspects of our SRH are higher on health and development agendas than ever before, and they have received steadily growing financial investment. There is also increased data and evidence which has made it possible to develop adolescent-specific guidelines and standards. A small but growing number of countries around the world have used these guidelines and standards to create and implement enabling legal and policy environments for adolescent sexual and reproductive health and rights in strong government-led programs. Civil society and grassroots social movements, especially those led by young people, have been influential in pressing for action and accountability. Finally, there has been growing recognition that new opportunities such as advances in technology and the press for universal health coverage can be leveraged to improve our sexual and reproductive health and rights.
However, there are still many barriers to adolescent sexual and reproductive health and rights. These include legal barriers such as requirement for consent from a parental or spouse to access services, social barriers such as stigma and having sex before marriage and the pressure to prove our fertility after marriage, and the service delivery barriers such as the cost and poor quality and health worker bias. Underpinning these issues are entrenched to gender inequality. Additionally, many of us still have difficulties to acknowledge us as sexual being and the view of our sexuality as a problem or something to be controlled. This is especially true for those of us who are LGBTIQIA and those of us who are with disabilities.
There are only 10 years left to achieve the 2030 Sustainable Development Goals agenda. To contribute to this and fulfill the unfinished agenda of the ICPD, what actions are needed? Looking forward, efforts to improve adolescent sexual and reproductive health and rights must build on the progress and lessons learned over the last 25 years to scale up what has worked. At the same time, stakeholders must move beyond more of the same and business as usual to achieve the things that we know are important but have failed to turn into action. Where there is political and social support, it must be mobilized and success must be demonstrated. Meanwhile, where strong support does not exist, the case for action must be made through acceptable entry points. External and domestic funding must be used strategically and effectively to demonstrate that investment in adolescent sexual and reproductive health and rights is worthwhile, while new and leveraged resources must be advocated for to fill the gaps. Efforts to communicate and apply enabling laws and policies must be stepped up, and changes must be made where harmful restrictions, contradictions, and loopholes still exist.
Human and system capacity must be strengthened to implement and sustain a comprehensive package of SRHR interventions, tailored to respond to our specific attributes, needs, and barriers at scale. This package must be integrated within the health system and coordinated with other sectors, such as education. The quality, equity, and effectiveness of these interventions must be proactively tracked using real-time disaggregated data, and good governance must be promoted. Last, but certainly not least, adolescents and young people must have a place at the table in order to actively and meaningfully participate in the decision-making that affects our lives. We are not merely beneficiaries. We are equal partners with knowledge and expertise critical to ensuring the appropriateness, effectiveness, and sustainability of action on ASRHR.
I think it was a really inspiring video. Although it did not specifically address COVID-19, it did give us a very good baseline to start the conversation about meaningful youth engagement. And now I would like to give the floor to Danielle, who would expand a bit more about UNFPA's work and WHO's work, specifically on COVID-19 intervention.
Sophie, just before yes. One of my messages, we made enormous progress over 25 years. We must safeguard that. And we must use COVID-19 as an opportunity to overcome barriers and build back better. So that's really the focus of what we are trying to do with UNFPA now. Over to you, Danielle.
Of course, thank you.
Thank you, Sophie. Thank you, Chandra. Good afternoon, good evening, everyone. My name is Danielle Engel. I work for the United Nations Population Fund, where I lead our adolescent health technical team. I am from Luxembourg, where I started as a young, I know that a lot of Girl Guides and Boy Scouts are on the call today. I started when I was 6 as a Girl Guide, Boy Scout, and I'm still today in my adult years very much linked and connected to the movement and the values it stands for. And I can actually say that the choice of my professional career has been very much influenced by my experiences in the Scouts movement. So that just on the side, but coming back to the topic which we're discussing today, and that is adolescents and young people's sexual and reproductive health and rights in times of COVID-19. Chandra already pointed it out in his intervention, but also in his message on the chat. When COVID-19 happened or gripped the world, it is true that young people were really not the first concern because they were not directly affected, at least it appeared, by the virus itself. However, people working in the technical agencies of the UN focusing on adolescent youth were very early on pretty alarmed about the composite effects which this virus would have on adolescent and young people's well-being and future prospects for their future health and fulfilling their potential in life. We have school closures, you all know it, you're probably all affected by it. In 194 countries, that means virtually every country in the world. We had billions of young people out of school. We have, of course, social distancing. I have 2 adolescents here at home and can see firsthand what that means for adolescents growing up, who really like to be with their peers and experience their identity with their friends, and that has all been abruptly halted. So we at working on adolescent sexual and reproductive health and rights had, of course, big concerns about access to SRHR. Chandra talked about the glass half full. That is true, that we have made a lot of progress in adolescent sexual and reproductive health and rights, but we also have felt that COVID had really the potential to drill a hole in that glass and empty it out quite quickly. So one concern, of course, was an increase in unintended pregnancies with the multiple and serious consequences of that, including school dropouts, reduced job and unemployment possibilities, increased vulnerabilities to poverty and exclusion, and of course, major health consequences as well. We know that adolescent girls 15 to 19 globally, their first mortality leading cause of death is maternal mortality. So that's why very early on, Chandra and myself, WHO and the technical teams in WHO and also UNFPA were looking at SRH, and we were going back to the essential package. If you go to the next slide, we're going back to the essential package of SRHR. I'll come to it in a second, and looked at what can we give as guidance to healthcare providers, to decision makers in countries, to our own country offices, to make sure that adolescent sexual and reproductive health and rights services do not fall off the table, and that we adapt these services to the new realities of COVID-19. So if you go to the next slide, I can just give you an overview of what the package of SRHR intervention entails. You can see it on the screen. There were 8 key interventions which we consider part of this package. The first one is comprehensive sexuality education. It's an intervention which is, of course, very strongly linked to adolescents and young people. So, of course, with so many school closures, we had a huge challenge that sexuality education could not be given in schools anymore. We had to move it outside. We had to use digital approaches for those who had access to digital interfaces, but also think about other ways of reaching those who are not connected to cell phones or computers. The second one is contraceptive counseling services, and again, a very essential service for young people who need counseling, who need hand-holding. Very often it's for the first time that they are reaching out to get contraceptives. So if that is not there anymore, how can we adapt the counseling to this new reality? So again, telehealth is an area which we have been pushing, but also giving our adolescents the information through other means than the health facility or the schools. You have the comprehensive abortion care. You have antenatal and postnatal care as the fourth intervention. HIV and AIDS interventions, of course, very essential for young people who are living with HIV, that they had access to their medicine, access to their care, but also, of course, prevention. Then we have gender-based violence services, which is an area which is concerning us increasingly around COVID-19. We have seen really an uptake of gender-based violence given to the lack of social mobility. Many programs of safe spaces have needed to be closed. The fact that schools are closed gives you adolescent girls, often schools are a moment where they are away from home if it is an abusive home, and also a way to seek help. That has been reduced. We have seen here in the US, for instance, a reduction of registration of gender-based violence or family violence cases, and that's not really actually an indication that they are going down, but it's an indication that young people and adolescents, including children, do not have so many outlets where they can actually ask for help. So that's a huge concern which we are looking at. Cervical cancer prevention, of course, HPV vaccination is an adolescent vaccine which has been paused in many countries. What does that mean? How can we resume it? How can we ensure that adolescents continue to get the care and the protection which they are entitled to? And then finally, menstrual health, another very critical area where we give recommendations in this brief on how menstrual health should be an essential service and should be included in essential services during a pandemic like this, and what could be approaches to address menstrual health during COVID-19. So that is, in a nutshell, the technical guidelines which we have issued to, as I said, to our teams, but also health care providers directly who directly work in the field. It's available to you all. Also, if you'd like to do some advocacy around this, if you'd like to advocate and like to say what needs to happen, this brief is telling you what we, from the technical side, think what needs to happen. But then we have done a couple of other specific briefs. If you go to the next one, the next slide. We have a brief on risk communication and community engagement, specifically focusing on young people. And here this is a toolbox which you can use if you'd like to do some work with your peers at the community level, with a specific focus on those left behind, so those who do not have direct access to WhatsApp, cell phones, smartphones, computer, Wi-Fi, but really also exploring ways of mobilizing communities at the grassroots level, which is of course very, very difficult during COVID-19 with social mobilization, social mobility restriction in place. But this is really a toolbox which has a lot of different approaches and ideas on how to do this. The next work which we did is focusing, and that's the next one, is focusing on one key intervention of the essential package, and that is the CSE, on comprehensive sexuality education. I already mentioned that required a big amount of adaptation with schools closing. What can we do? And UNFPA, together with our partners, including WHO, UNICEF, UNESCO, UNAIDS, have issued also last year, international guidelines on out-of-school CSE. Which addresses how you implement sexuality education in out-of-school settings. This guidance note was in the making before COVID, but really came out handy at the moment where schools were closing. We have these guidelines of how do you do CSE, how do you implement CSE programs in out-of-school settings. And this brief here, Learning Beyond the Classroom, really targets COVID-19 specific considerations. The next one, which I hope Sophie will share with all of you, is another main concern which we have, is that we have been working together with our colleagues in UNICEF on reducing child marriage, and we have a big program with UNICEF in many countries to address preventing child marriage and also working with girls who are already married. Now, these programs are very face-to-face intensive. These are often programs which rely on safe spaces for girls, on community engagement, on really this face-to-face interaction. And so we needed to readapt the work we were doing in this area. And so we issued this guide, which gives some ideas of how can we work with young girls and continue this really important work, which we have really concerned that COVID-19 and the socioeconomic crisis, which is at the which we expect to follow, will have as an impact a higher child marriage rate. So again, in an attempt to see how can we scale up our programs despite of this crisis. And then the last one, I think, is not the last one. This is a campaign which we ran and which is still up and running and which you can still use. And I'd like to invite you all to check it out. It's #Youth Against COVID-19, where young people, which we, by the way, did together with Scouts and IFMSA and many other youth organizations. So it's a series of 6 videos which we developed together with the software company Crazy, where young people covering all essential issues around COVID-19, including SRH and COVID-19, including mental health of adolescents and young people and COVID-19, where young people can take these videos and record them in their own languages or give their own spin. So the content is provided by us and the technical partners, but the way you use these videos with your own face and your own language, they have been translated in many languages, and they are there up for grabs for you to mobilize people around the world on COVID-19, in particular young people. And then the last one, I hope, is a technical brief which we have done on service and assessments, because I'd like to take a second to just also say that right now we really don't know for sure what is happening on the SRH and as a result of COVID. It will take some time for the epidemiological picture regarding adolescent and youth sexual and reproductive health impacts to emerge. The numbers which we have right now on teenage pregnancies, for instance, which were issued in 2020, are from 2018. So, it takes time for us to compile at the global level the indicators from all the countries. So we'll probably only see in a year or two if there has been a spike or not. We have anecdotal evidence, of course, from some countries, But even in Ebola, for instance, where we had some surveys which showed an increase in teenage pregnancy, the data was not particularly reliable. And one of the reasons for that is that very often when surveys and assessments are done at the country level, the adolescents and youth, particularly very young adolescents, that age bracket is not very well captured. And so this is a brief which I would like to invite you to look into so that you advocate with your counterparts, your governmental counterparts, your agencies, whoever is doing any assessments or looking into the impacts of COVID-19, to also include in any survey some key questions which relate to sexual reproductive health and young people. And there was, in this brief, you'll find some sample questions which you can just copy and paste and put into your survey, so that we really get more reliable data and that we can then also assess what has been the effect of COVID-19 on adolescent sexual and reproductive health and rights. In the meanwhile, we continue to work together, Chandra and I, to move this agenda forward, to continue to fill the glass up and stitch up the holes together with all of you. And we hope that this is just the start of a longer conversation with all of you. And I'll stop here, Sophie. Over.
Thank you so much. This was just a really great example of how both WHO and UNFPA work to give us the necessary resources and guidelines, and also include young people in the conversation so that we can come up with solutions together for the pandemic, before the pandemic, but also after the pandemic. And I would like to remind everyone that below this session, you will see a couple of links. We've attached several of the guidelines and technical toolkits that Danielle just mentioned. And we will be uploading some more in the following days before the summit finishes. As always, if you have any questions for Dr. Chandra and Danielle, please let us know, write it in the chat, and we will address them. And I already see some questions coming in. So question for Danielle, is there a pre-existing CSE and life skills curriculum that schools can use for non-formal education purposes, example, after-school clubs?
Yes, the answer is yes, there is. Of course, there is the international guidelines, the international technical guidelines on CSE, which is like the gold standard of what CSE should be doing in the different ages, from the very young to the older children, adolescent, youth. We have the out of school, as I mentioned. We have now the complement to that is the out of school guidelines. But we also have specific, there are some curriculum guides. I know there's the all one from the Pop Council, if I'm not mistaken, but for UNFPA, we have issued a whole guide on, and I can share that link, on lesson plans, facilitators guides, all that is available. And we are currently working on a minimum package of 12 key lessons which need to be in each CSE program, also out of school, specifically what you were saying for out of school or after school programs. But these lesson plans are available, and you could find them on UNFPA's website.
Just to add to that, Sophie, if anyone is particularly interested in curricula for your country, reach out to us, send an email to us. We'd be happy to put you in touch with people in your country and give you access to curricula that is already available in your country. Many of the times we don't need to reinvent the wheel.
Thank you for that, Dr. Chandra. Well, the questions are...
Call me Chandra. We're all equal here.
Thank you, Chandra. Well, we have, so you want us to send our emails in chat. That's the question that came up. Would you like to address that, Chandra?
What's the question?
You want us to send our emails in chat because you mentioned that people could just send you emails. So
yes,
I think
I have posted my email address in the profile, in the Juno profile, and you have I have my email address there. Daniel and I will respond to any emails that come to us, and we'll give you specific suggestions in addition to these generic tools.
Just as a request, if you send us an email, which we are very much welcome, please say, I was a participant in this session, so that we know where it's coming from. But very happy to put you in touch with our country offices, which are in, I mean, both WHO and UNFPA has country offices in virtually all the low and middle income countries. And, you know, also put you in touch with some practitioners, which we know of, and are implementing partners for us in your countries, if you're interested in this work.
Wonderful. Thank you for that suggestion. And while the questions are still coming in for Chandra and Danielle, I would like to perhaps ask both of you if you could tell us more on how those guidelines were compiled. How were young people included in that process specifically, if you'd like to share that?
Let me start, and then Daniel can add. So last year in March, when COVID became recognized as a pandemic, one of the things we have done is we consulted young people around the world through various networks to identify what their questions were, what their concerns were. We used that to do a joint UN Q&A. I don't know, Daniel, if you have access to that. That's part of the tools that Daniel put together. So so that was the first step, identifying what their needs were. And then based on the Guttmacher Lancet Commission, we put down some simple instructions for health workers on what to do. Consistently, as we went along, we got young people's inputs. And now what we're doing, more importantly, we wanted to get those guidance out to the countries. But what we're doing now is we're gathering case studies from around the world. We're gathering case studies of how programs are responding to the needs of adolescents for contraception, for abortion, for sexuality education. And we are working with young people, the International Youth Association for Family Planning, for instance, to go out and check these institutions and see whether they work, whether they are actually there in place, whether they are friendly. So young people are involved in identifying what their needs were, in developing the tools to guide them, guide providers, but also to identify and vet case studies. Over to you, Daniel, in case you want to add something.
Yeah, no, not much to add. And as Chandra, my bad. I should have, of course, also shown the Q&A, which we have, which is part of the package. And I think Sophie has shared or will share with you the entire package. You can click the link and you'll find all the different briefs, the COVID-related use briefs of UNFPA. And the Q&A is, of course, part of it. And it's probably really an interesting piece, even though I have to say it might need to be revised because that was really done at the very beginning. Last March, there were no vaccines yet available. It were really at the early stages to understand the virus. So much has changed since then. Yeah, young people have been, we are in touch with young people all along. As I said, I mentioned the Youth Against COVID-19 campaign, which we, of course, worked together with many youth organizations, many of them represented here. So yeah, but I have to also admit that the Not on Pause, for instance, had to be developed very quickly, and we based it on the Journal for Adolescent Health supplement, which, as Chandra said, had benefited from a lot of inputs from young people. And I'll put in the chat a link to, as colleagues are interested in curriculum or lesson plans, I'll put in the chat and a link to lesson plans from UNFPA.
Sophie, there were two questions in the Q&A that we can try to respond to if there's time. How much time do we have?
We have, let's say, 5 minutes. We can take a 3 minutes break then.
There was a question about what can we do to make sure that young people in the rural areas can have contraceptives and information and not be left behind. I think the most important decision for this is national leadership. I won't, in the Journal of Adolescent Health Supplement, we have included a number of case examples. And one case example is of Ethiopia. Ethiopia now is going through a very difficult time in Tigray and Oromia, but Ethiopia achieved enormous success in increasing contraceptive access and uptake from near 2% to 40% over a period of 15 years. And this was particularly among women and girls in the rural areas, because there was a deliberate program of investment. Uruguay did exactly the same thing. Uruguay achieved improved access to contraception and reduction in adolescent pregnancy. I think providing education and services does not cost an enormous amount of money, but it needs national leadership. It needs national leadership. Without that, NGOs like Maureen's NGO can make small contributions, but that's not enough. You really need government leadership to play this role.
Sandra, I think we can also take the other question that came in. What is the relationship between mental health and SRHR during COVID-19 pandemic, and with regards to lack of access to SRHR services specifically?
I can add to what you say.
Okay, did you want?
Would you go first before, and then I can add to what you say?
Yes. Well, there is, of course, I already to some of the mental health issues which we are seeing. I mean, GBV has direct impacts on the mental health of adolescent girls and young women. Teenage pregnancies, early unintended pregnancies, really puts lives upside down, and has, of course, a direct impact also to the mental health and well-being of adolescent and young people. Issues of leaving school, dropping out of school, seeing life projects upended because of the COVID pandemic or other, is of course also that has an impact on mental health. So I think there is a direct link, which we have to consider, which we need to take into account. And UNFPA has been working recently much more in depth on mental health and psychosocial support, in particular in humanitarian and crisis settings, but not only, and linking SRHR services to also mental health and psychosocial support. I think I mentioned the issue of counseling as very critical, as a very critical service for adolescents in particular. So there is a direct intersection between the work we are doing on providing adequate sexual and reproductive health services, commodities, and intervention, while also putting the young person in the center, taking a human-centered approach and looking at the whole adolescent girl, the whole adolescent boy, the whole young person, and also addressing any mental health needs. I'm sure Martin could also speak to this, seeing the link between sexual identity and mental health. And how this all intersects. It's a pretty straight line. So over to you, Chandra, and I don't know if Martin would also like to.
Happy to make a quick comment and then to have Martin add. Martin already spoke to that. We've heard from young people who identify themselves as part of the LGBTQI community that being stuck at home with your parents, when it's extremely hard. This is already there's tension. And you're all kind of stuck there in a climate where there's financial constraints, there's household food insecurity, and all these tensions just get aggravated. I just want to make 2 points. One is mental health problems did not come only because of COVID-19. Mental health problems have been there. And among girls, mental health problems are a big problem. It's a big problem. You have mental health tends to decline in girls during adolescence, and you can understand why. There's a lot of sexual harassment. There's a lot of gender inequity. There's a lot of control, and so girls recognize that they are being suppressed and they want to fight back, and it's difficult for them. And suicide is another very big problem in female adolescents. And what has happened with COVID is, in countries like India, Ethiopia, girls have to stay at home. They can't access school because the internet doesn't work, or there's one computer shared by 5 people in the house, and they're doing more housework. So, you're trapped. You can't talk to your friends. So it's just worsened and worsened the situation. 2 days ago, I was in a webinar including people from Belgium, and there too, girls have been suffering from huge increase in stress and anxiety. So this is not a poor country issue. This is a worldwide issue.
Chandra, Martin, would you like to add anything?
Yeah, I just want to reiterate. I think the quick answer about the links between SRHR and mental health will be huge. I think to say the least. And I think when we look at as well LGBTIQ young people, particularly trans and non-binary young people's impact on mental health has been unprecedented. First, because actually online spaces have become so much more dominated, and young people were more present in those spaces who are really toxic and very abusive, obviously, when we face a lot of discrimination there. But also, as I mentioned, so many countries around the world weaponized like really human rights to attack particularly trans young people's access. So being denied adequate access to any kind of healthcare, including sexual and reproductive health care, it has huge implications, long life implications for young people, particularly the trans non-binary young people who are often missing from this conversation. And I think another element we sometimes as well forget as well, which has really impacted, not necessarily with SRHR linked, but is grief. And I think our young people navigating grief in this time is really complex. And on top of that, as mentioned, having this hostile environments when they have complicated relationship with their relatives and parents, whether they're out or not, whether, and losing them, some of them at this time is really complex. And once they lose as well that home, whether they're kicked out or not, they have not many options in many countries across the world. They cannot access any mainstream healthcare services because they're not gender affirming or they're not inclusive, but they can also access LGBT specific services often because of age restrictive laws that I mentioned as well. And I think it is a really complex, and I think it will take a while for us to more unravel and discover this, the serious impact that it has had. But yeah, we definitely know it has.
So, could I just add a quick point, Sophie? My wife, I'm originally from India. My wife is originally from Spain. She's a psychiatrist here in Switzerland. So she deals with trans patients. She works with trans patients and gives them support. The harassment that trans patients, trans people have in Switzerland, Western Europe, is incredible. On the street, in the offices. One of her patients has been looking for a house. When they go to look at a house, they're thrown out by the tenants who are there. It's not even their house. It is they're not even allowed to visit the homes. They have to work through agencies to find it. And in countries like mine, and in many other parts of the world, it's even worse. And what you're seeing in many Eastern European countries is a going back on the progress that we've had.
Absolutely, it's the same here in the UK. It's like 100% increase of access to homelessness. We've seen as well hate crime are increased, but this is also like how much is being reported. Is there data? So this is the countries that actually report it, and those that don't, we don't really know. And we know that it's prevalent from people bringing up this lived experiences, but it's really and it's really dangerous that how it's being weaponized, like you mentioned, in Eastern European.
But Martin, even having said that, I want to come back to the glass half full.
Yes,
come back with stories. Daniel and I are putting together case studies. Let's show, some initial steps somewhere. If you identify that, work with us, we can post them because we want to give people hope.
Yeah, and I think on that note, I can give hope. I think on the other side, we know a lot of queer young people really stepped up during the pandemic. They have really provided strong support. Particularly, we have cases from, I'm happy to share some of it. There's a great article that we published with the Envoy on Youth office together, highlighting some of those cases around particularly supporting trans young trans people's access to SRH services, and how queer young people stepped up to do that in Argentina, but also in India and other spaces. And also because we're online, and we give us an opportunity to really address some infrastructural issues around civil society. And we are launching this year a global queer youth network with queer youth organizations across the world, and to address something that's already existed across for a really long time, and to particularly look into the links between reproductive rights and LGBTIQ and how young people are there. So there is good examples, and I think it's good. Thanks for reminding us that. I'm happy to share that article to highlight some of those as well, which is great.
Sophie, I'm sure we've gone on for too long. Over to you. Throw us out.
I would like to add something when you come back on mental health and SRHR.
Also, just to say that there will be a whole session on mental health tomorrow. I mean, I know that because UNFPA will be speaking about our program, Time to Heal. But perhaps, Sophie, this is a moment to beat the drum for the Every Mind Matters plenary, which is tomorrow, I think, in this space.
Sophie, can you hear us? We can't hear you, Sophie.
Maureen wanted to come in on the mental health issue.
Yeah, I think I can just go fast. So that was a very good question on relationship between mental health and the SRHR. So speaking from the work we've been doing, the work that we've seen, that it is easier, there are most young women that have been stigmatized, for being, for falling pregnant. And that is a lot of judgment for your reproductive health. And this doesn't go away because the community judges you and you lose friends. And when your financial capability is not that okay, then you have stress. And in a community where people accept when the parents or the elders give you away for marriage, and it's okay as a child, but when you fall pregnant under the circumstances, then you get backlash. So it is so major that you find yourself in that area, and with in a place where there's no counseling, then you fall into depression. The bad fact about this is that many times in the local community, some young women don't really even realize that they are having mental health issues. And we also have a lot of even activists. A very good example, we had an activist that had a sort of a miscarriage, or in quote unquote, and she was really, yet she had lost her life through the process. So it is a lot of stigmatization towards women. And what we've worked through, that I've worked through personally in my area, which is a remote place, is the cases of SGBV, which have been on the rise a lot, even the children of the age of 2. So there've been defilement of children, and there's no jurisprudence at all. Then the perpetrators are back in the community, and this is no good. The child is traumatized, and the circle of violence. This is something really. It's a fact in Kenya, in my area, that counseling services is really not easy to access. We have professional counselors, but when you have them to access, so that leaves us as community workers with YWCA step in and do a small plan. So yeah.
Thank you for stepping in, Maureen. Thank you for sharing your insights, definitely on very important topics. You are doing great work, Maureen, indeed. We have a lot of comments and questions coming in. To every speaker, personally, which SDG is the most important to you? Who would like to take the question first? Maureen, perhaps you would like to?
Wow, okay. When you say the most important, you cannot put me in a box. But I really work a lot on SDG 1. where we are advocating for ending poverty. And because in my own understanding is that poverty is not only lack of food, but lack of education, lack of access to health, that is poverty, lack of good housing, that is poverty. So yes, SDG 3 is also one of my, stopping points, because we have to address the issues of, the health, and we have to address the issues of in terms of well-being as well, and equity issues in SDG, one of our core areas. So really choosing one for me, I just have to go with 3 and many more, but for now 1, 3 and 5 is what we work on a lot in our local area and this points.
Danielle, maybe you would like to go next.
It's funny, I have a soccer ball here at home, which I can show you in a bit, with all the SDGs on it. And my son asked me yesterday exactly that question. From all of those, which one do you prefer the most? Like Maureen, I think they're all interconnected. It's very difficult to choose one over the other. Of course, for in terms of the work we're doing, we're working on the SDG, on the health SDG, the gender SDG. I think absolutely critical. Unfortunately, we're not yet where we would like to be as a global community on gender equality. We just discussed this in this seconds ago. So that's something which is really close to my heart. But also the SDG on peaceful societies, I think is important in this divided world in which we are living. Coming back to the core mission of the UN of peace building, and peace building in the larger sense. And I also believe that that's an area where young people can play an absolutely critical role. And again, the work which we are doing at UNFPA is trying to amplify and open that space for young people. And then I think on a personal level, it's also the environment. It's not an area where UNFPA directly is involved in terms of programming, but we all feel the planet in which we're living and how we need to take better care of our common home. Over to Chandra.
For me, I don't want to talk about SDGs. I want to talk about acknowledging that adolescents are sexual beings. That should be a center of this. I'm 62 years old. I started having sex before I was married. I wanted condoms, and I would go to get condoms far away from home, where I knew my mother would never go there. I would hang around outside the pharmacy till everybody left, and then go and ask the chap for condoms. Many times he looked at me as if I was a piece of shit, and then he would give me the condoms or throw me out. I can still see his face. I can still see their faces. So that's the issue. We have to acknowledge adolescents as sexual beings. In the little video, whether you have a disability or not, whether you're part of a sexual minority or not, we are sexual beings. And when communities can't accept that, they can't talk about menstruation. They can't talk about masturbation. I remember my son is 30 years old now, but he used to, one day cycling, he asked me, "Dad, do you masturbate?" I said, "Yes." The point is, we have to be able to talk about this with our kids. And if we don't do that, the SDGs just remain sanitized words on paper.
Martin, would you like to add anything?
I'm not sure how to follow that. That's very right. I think as well as like when you look at the LGBTIQ specific stuff, it's like often LGBTIQ people feel a bit disengaged from the SDGs, and sometimes we feel like left out, right? Because it feels like, oh, we weren't really involved there, whilst actually a lot of our rights are impacted by those conversations. I don't have a favorite, as I really don't like as well that sometimes like we put as well people in different categories and boxes and we're part of the conversation. But I think the most probably important one is going to be what I mentioned before, is like, the last one, that working together and collaborations, is acknowledging that, you can't achieve anything if there's no ownership of these conversations around sustainability by the communities themselves. If queer people don't feel like they're meaningfully involved and have some ownership of these conversations, they wouldn't care about the SDGs, they wouldn't care about these conversations. And also, if you don't involve like different sectors from it, whether it's, you know, private, public, communities, and young people, older people, or across the intersections, it's no way we can get there to that point. And just bringing on a personal last note is that when I started as well, like my activism, I often felt out that, you know, conversation around whether it's like SRHR or comprehensive sexuality education was really not about me, because it was all very heteronormative, you know, and it didn't include that. I think I hope we like translate the SDGs into some, if we have only 10 years left, to something that really brings true to people on a day-to-day basis, because not everybody knows about indicators. You know, what does it really mean to you on a day-to-day basis?
Thank you, Martin. And I see you shared an article in the chat from Medium, and then Suchi also shared 2 videos about the ABCs of CSC, so I urge everyone to check those out. Thanks to all the speakers for the great answers. Indeed, Orlando. I would like to, so we have 17 minutes left until our session is over, and I would like to ask the participants as well as the speakers to steer the conversation towards solutions. So we talked about the glass half full principle, and we also talked about a lot of challenges, and I saw in the chat a lot of the participants connected with the stories, and some of them also were comfortable enough to share their own experiences or their country cases with us. And thank you all for that. Perhaps let's talk about how can we achieve those changes? How can we include more queer people in CSC? How can we ensure accountability? How can we ensure sustainability? So this question goes out to the speakers as well as the participants on social media, YouTube, chime in, and through Juno. Please feel free to send us a few sentences while we listen to our speakers, if anyone wants to go ahead and share their thoughts.
Okay, thank you so much. Maybe I'd like to go first. So how can we achieve the CSC? So first of all, that is a hot topic. Now we had the CSC, part of it being implemented in schools, but it stopped immediately because the view was that we're teaching the school, the adolescents about sex, you know, the intercourse. But now, at the moment, there are level of how to really go about the CSC, because in our communities, the teachers, they still really don't understand, and they feel if they accept CSC, then it will be opening a Pandora box of young children having sex. But now, the reality is young children from the age of 8 right here in Kenya, right here where I am, are having sex. Another reality is that we need to advocate and make an understanding that CSE is not teaching about sex, it's teaching about sexuality, and is composed so many different aspects that if these young children know, then it will protect them. They'll have better choices on their own lives. So first we need to make the community and the government understand sexuality and their importance and the impact of no education on CSC on the government, and also conduct a lot of advocacy that really push for implementation of the CSC, because empowered and have access to their own, you know, body autonomy and have access to what they want to choose to do. So I am one promoter of CSC. Thank you.
Can I build on that, Sophie?
Maureen. Of course, Chandra, please go ahead.
So thank you, Maureen. So what we are trying to do to build on what Maureen said and Martin about ownership, We're doing 3 things with young people, and we'd love to engage this with you. The first is telling them what their entitlements are, making sure that they know that the government has promised to give them CSC, or the government in the law has promised to provide them with contraceptives. Many adolescents don't know what their entitlements are. And that's the first thing. Now, what are you as a citizen of your country entitled to within law? The second thing is, so that is eyes and ears. The second is voice. How do you make adolescents go and advocate for these activities, teaching them how to advocate for CSC, for example, in India for menstrual pads, for instance. And the third one is accountability. How do you make sure that adolescents can then check and make sure that they get the services? So that is teeth. So eyes and ears, voice, and teeth. And that's how we are trying to work with leadership on the ground in countries. If anybody's interested, we are very happy to engage with you.
Thank you, Chandra. Danielle, would you like to answer the question as well, perhaps, about sustainability, about engaging young people, about solutions, basically?
Yeah, well, like Chandra said, we as UNFPA, for those who don't know us, we have been engaging young people for a long time. UNFPA is governed by a consensus on population development, which was built in 1994 by all the governments around the world, which is for us the famous program of action of the International Conference on Population Development. And in that program of action, adolescents and young people, there's a whole chapter on adolescent and young people as critical in terms of moving forward the SRH, sexual and reproductive health and rights, and being the actors, active participants and agents of positive change. So that means for us as UNFPA, young people have always been in the center. They're at the center of our strategic approaches, which we do at country level. In most of our countries, I can say we have youth advisory boards, where young people help us advise on our programs, they help us design the program, they help us, as Chandra is saying, they help us also evaluate programs. We have launched the Nairobi Summit, which Chandra mentioned in 2019, together with many youth organizations, an accountability charter about youth accountability, and our programs be accountable towards young people, and how can young people be involved in that. We also involve young people in the research and monitoring and evaluation of our programs. So there are many avenues. We have a youth reference group for UNFPA, which helps us advise, and if any, it's organization based, but if any one of you who is part of an organization would like their organization to join that work, please let me know. You have my email in the chat, and we'll make sure that we include you. This is a very transparent platform where we engage regularly with organizations to listen for you.
Thank you so much, Danielle. Martin, any concluding thoughts or anything about ILGA World, perhaps?
I'm sorry, Sophie. We were breaking a little bit, so I didn't hear your question. Can you just repeat? Yes, sorry.
Yes, of course, no worries. I was just asking if you would like to share any concluding thoughts about youth engagement, especially LGBTQI+ young people's engagement through ILGA World, perhaps?
I think just as well bring the positive elements like we talked about as well, is that there is, despite obviously all the attacks that we're seeing, despite all the regressive politics and backlashes we're seeing, whether it's on reproductive rights, whether it's on LGBTIQ rights, trans rights in particular, we've seen as well a lot of resistance. And I'm really pleased, for example, to see like UNFPA's State of the World Population Report this year, which is around bodily autonomy and the right to self-determination, which is a big step. And it means so much for communities like us, it means so much to me and my work to see really that there. Because I do remember 7 years ago, just to showcase the progress, reading the State of the World Population Report, and we had to make them youth inclusive, some of the parts of it. And I was a bit disappointed. There was not, apart from MSM, there was many mentions, of LGBT people and within it. But we've come so far on this, and I think it's important to remember that there are milestones we should celebrate, and I think we should also hold the stakeholders who committed, that they're really shouting about our rights and really saying that they're really there to do that, to hold them accountable and actually, okay, so what do these actions really mean for our communities, whether it's states, whether it's UN agencies, about their commitments, whether it's others as well, to hold them as young people as well accountable for their commitments. And I think there is a momentum that we can utilize now within those spaces to bring some progress. And I am quite looking forward to, so we can finally not only campaign about people not being left behind, but those that really have been left behind for a really long time be actually at the forefront of the conversations and lead those dialogues, so we can actually ensure that we achieve what we set to do.
Thank you, Martin, for this nice shout out. Our State of the World Population Report is called "My Body Is My Own." I put the link in the chat. It's quite, as Martin said, and I'm happy you said it, and I didn't have to say it. I also think personally that it's quite a remarkable report. We issue these every year, of course, but it's every year a different theme. And this year it talks about bodily autonomy, and it's quite groundbreaking. Also knowing that this is such a delicate topic in intergovernmental discussion, so that UNFPA came out with such a progressive report, should make us all very optimistic. So take a look, it's in the chat.
Thank you so much for that. I see a lot of resources being shared in the chat, emails, links to organizations and articles, toolkits, all of that, which is fantastic. And as I mentioned, some of the toolkits are uploaded at the end of the session. So if you scroll down, you'll be able to download 2 of them for now, but the rest will be added throughout the global summit. And you will be able to download all of them by the end of tomorrow. I would also like to read a couple of comments before we conclude. So I see Carol talking about framing that is excluding LGBTQI+ populations. So just looking at the framing of SDG 5, working for gender equality, the majority of conversations surrounded women and girls, which are critical conversations to be having, but it is critical to include trans, non-binary, LGBTQI+ populations and beyond. Very good point, definitely agree with that. I think one of the most crucial solutions to enable better sexual health education for LGBTQI+ populations is to expand definitions of gender equality and health. Very good point. Then we have Kelly writing, my country has a really backward mindset, especially when it comes to anything sexual, and even more so when it comes to LGBTQI+. We learn in textbooks about how identifying as anything but heterosexual is a disease that can be contracted with this disease by associating with people who are a part of LGBTQI+ community. Very harmful, but thank you for sharing that. We are also having LGBTQI+ Youth Initiative later, which will be launched on the 17th of May, says Martin. Thank you. Yvonne says, YWCA Kenya's SRH, our mental health diagnosis app, is great towards self-assessment on mental health and well-being. And thank you, Maureen, for sharing. And then Carol says, I'm writing a paper on this topic currently. Good luck with the paper. So as we sum up this wonderful discussion, I'd like to highlight some of the points that were mentioned by our speakers today, which was mental health, diversity, intersectionality, LGBTQI+ involvement. We also had service provision, especially in rural areas for marginalized communities, including young people, postnatal care, and mobile services. A lot of interesting discussions, a lot of good solutions came up throughout the discussion. Thank you for participating. And as we conclude today's session, I'd like to direct everyone's attention to our Slido. Just a second. We have, 23 answers. Amazing. We have another question for you. Did you find this session insightful? Yes, somewhat a bit. If you would like to participate, please type in www.slido.com and the passcode is 999571. Again, this is slido.com 999571, and you can always scan the QR code as well. And please feel free to participate if you are joining us through the Juno platform, or if you're just watching the live broadcast on YouTube or any other social media channels. And so far we have 11 participants saying yes, they did find the session insightful. We can go to 12 answers. Fantastic. We can go to our next poll question, which is there anything new that you have learned? Please feel free to share with us, elaborate. Slido.com 999571. So was it a particular resource or anything that any of our wonderful speakers shared today that you found fascinating and that you have learned about? Feel free to share with us all the international initiatives and resources. Yes, we have a bunch of resources in the chat and also uploaded on the Juno platform. There can and should be sexual education for LGBTQI+ needs for sexual inclusion of LGBTQI+ communities. I was interested to hear things from different perspectives and compare it with my country. Yes. Let's see. ABC to CSC. Yes. Thank you, Suchi, for sharing that link, that resource. A lot of people apparently found it very useful. Anything else that you would like to add? Sexual and reproductive rights, LGBTQI+ rights, and women's rights go hand in hand. Indeed, that is a very good takeaway from the session. What else? Equity and inclusivity is key. Yes, definitely agree with that. And we can also, a lot of answers. Okay. I think we can go to our final slide, which is a bit of a vibe check. So how do you feel after the session? One is tired, which is understandable because it's quite late in some parts of the world right now. And 10 is fantastic, energized. I want to hear more. I want to be engaged more. So feel free to share. We have a strong 10 and a strong 9 and a medium 8. 11 participants. I think the energy in the room is good. I think we have a lot of happy participants. We have a 7, which is understandable. It's quite late. So on a Saturday evening. So I would like to thank everyone for their time today, for their participation. I will be closing the call right now. And I would like to remind everyone to check in the resources, write down the email addresses shared in the chat. If you find if you find yourself asking questions about SRHR in general, you can always consult www.uac.org as well. We have a lot of resources about advocacy, specifically for young advocates and young people. And Danielle also mentioned a youth reference group. So if you're interested in joining, please feel free to drop us a line. And I will also write my email right down below. And if any one of our speakers wants to share anything, final statements, please feel free to do so.
The final statement is thank you, Sophie. You did a great job. And to all the wonderful people who work behind the scenes, Rebecca and all the others. So this came together very well and you did a great job. It was a fun session.
Thank you so much, Chandra.
Thank you, Sophie. Thank you, everyone.
Same from my side, Steve. Maureen. So from the whole UNFPA family, thank you so much for giving us the space to exchange with you. It's always a pleasure. Thanks to all the participants for your interesting questions and your engagement to make the session really interactive. This was a lot of fun. Thank you so much. Also, the team behind it, the Juno colleagues and the Global Summit team. Well done, Sophie, and hopefully we'll stay in touch.
Yes, thank you so much for Maureen.
Good night.
Thank you so much for Maureen, and let's remember to include everyone, PWDs and everyone. Thank you. Bye.
Thank you so much, everyone. Bye-bye. Take care. See you in other sessions.
Oh, finally, we have done a great job. May God bless us. May God bless the world YWCA.